This video is a demonstration of the Children's Hospital Assessment Team, or CHAT. A CHAT is a rapid response multidisciplinary team of specialized nurses, respiratory therapists, and prescribers both from the patient's primary team and from the ICU. A CHAT can be activated by any member of the care team, including patient parents or family members, based on either standardized indications such as elevation of PEWs or pediatric early warning scores, sepsis criteria, acute neurologic changes, or any other care team member concerns. When criteria are met and a CHAT is activated, the bedside nurse will notify the unit charge nurse. For medical patients, the bedside staff will then notify the most senior in-house medical staff member, which would be a fellow or resident. And for surgical patients, the bedside staff will notify the surgical attending or fellow via smart web paging system. In the event that a patient rapidly deteriorates, the surgical senior resident would also be paged at that time. To call a CHAT, dial 8-CHAT or 82428, or call the operator and state activate CHAT, and then provide your name, the building, the unit or clinic, and then the room number. The CHAT nurse and respiratory therapist will respond within 15 minutes. After their initial response, the CHAT nurse will then notify the PICU prescriber on call, who will then assess the patient as appropriate. This video will provide a brief demonstration of the appropriate nursing, respiratory therapy, and prescriber responses to a pediatric rapid response call, or CHAT. Today, we will be following the case of an infant with bronchiolitis who is experiencing worsening respiratory distress.
Hey guys, I'm with the CHAT team. I'm Autumn, I'm the CHAT nurse.
I'm Caleb, I'm the CHAT RT.
Okay.
I'm Nick. I'm one of the resident doctors taking care of this one.
Yeah, and I'm Stacy. I'm Maddie's nurse today.
Okay, tell me a little bit about what's going on with Maddie.
Yeah, well, she's a 10-month-old, 10-kilo patient. She is admitted with bronchiolitis. She came in a couple of days ago. She had some increased work of breathing, some poor feeding. We did some, of course, lab work and swabbed her, and she was positive for RSV. Initially, she was doing okay on the 1 liter nasal cannula for her oxygen, and then she had to escalate up to 2 liters. But over the last hour, she's had some increased work of breathing. That's when I called Dr. Rockwell over. She's having some nasal flaring and some retractions. Her respiratory rates went up to 60, her heart rate to 175. Her SATs keep dropping down to 88% on the 2 liters of oxygen. And so her pediatric early warning score increased to a 6 at that point. And so we went ahead and activated the CHAT.
Okay. Does this patient have any access?
No, she's been eating pretty good up until really just the last couple of hours, but definitely didn't take much this morning.
Okay. I think we probably need to go ahead and start a peripheral IV and maybe go ahead and get a blood gas. I think that's probably going to be the best course of action. And then do you want to go ahead and give a bolus?
Yeah, I think so. Stacey and I were talking about it. I'd go ahead and give 200 milliliters of LR. I think that'll be a good place to start.
Yeah, we're going to try some suctioning as well. I'm probably going to benefit from some high flow nasal cannula as well. So.
Yeah, why don't we maybe do 15 liters high flow? Does that sound good?
Yeah, that sounds reasonable. Yeah.
All right.
Okay. Well, I'm going to go page the PICU provider and let them know kind of what's going on, give them an update and where we are and what we're doing, and see if they have any other recommendations.
Okay. Yeah. I'm going to run grab the IV supplies if you guys are going to be in here with her.
Yeah, we'll get
and grab the
suction
fluids
going
as well.
here.
Okay.
All right. That
sounds good.
Hey guys, I'm Dr. Newman with the PICU team. What's going on?
Hey, Dr. Newman. So this is our patient that we have here that CHAT was called on. Okay. She's a 10-month-old, 10-kilo bronchiolitic, was admitted positive for RSV a couple days ago for some respiratory distress. She today had been escalated to 2 liters on her nasal cannula for some DSATs and is still only satting high 80s on the 2 liters. So they called the CHAT. She's had some poor feeding, so we went ahead and started a peripheral IV, and they're given the 200 ml LR bolus right now. We also got a blood gas, which seemed reassuring to me, but we just wanted to kind of see if you had any further recommendations.
Yeah, I definitely agree with you guys. She certainly looks like she's in respiratory distress with her heart rate elevation and tachypnea. I think the 200 LR bolus was a really good idea as well.
And then Kayla and I had talked about starting high flow. We were going to do 15 liters, which would be about 2 liters per kilogram for her, and see how she does with that.
Okay. Yeah, I think that sounds like a great idea. Maybe it sounds like our stats are kind of marginal. Maybe we start at 40% and see
that
how she
sounds good.
does.
Yeah.
And you guys have already suctioned really well. Is that correct?
That's
Great.
correct.
All right. Maybe we'll start at the 15 liters, 40%. We'll see how she does. Particularly, we're going to be looking to see if she has improvement in her vital signs and work of breathing, and make sure she's oxygenating well and keeping her stats over 90% or so while she's awake, especially.
That sounds good.
And then what I would do is I think if you start those interventions and after the bolus, if her heart rate's not coming down, if her work of breathing's not looking any better, and certainly if our stats are getting lower, then definitely call us back. Because if we're needing more than 2 per kilo or more than 50%, then I think she'll probably need to come to the ICU at that point. Okay. Dr. Rockwell, does that seem reasonable to you?
Yeah, I think that sounds good. I think Caleb's going to work on some stuff with chest PT, and we'll see how she does.
Okay. And does everybody feel comfortable with her staying here for now, and then we'll reassess and make a plan for coming to the ICU later if anything changes?
So.
Yeah.
Does she need any maintenance fluids after the bolus?
Yeah, I'll put some in.
Okay.
That way we can just keep her NPO for now.
Yeah. Okay. Sounds good.
Perfect. I'll let the rest of the ICU team know about her just in case anything changes, but certainly if anything changes, just give me a call back and I'm happy to come reassess.
All right.
Okay.
Thanks.
All right.
Thank you.
Thank you,
Thank
guys.
you.